The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to this special session of the RHSC GFF and Financing Workstream call. Today we have a special session planned, a webinar, which is entitled How to Find GFF Information in the Labyrinth of the World Bank website. We have with us today Sangeeta Raja, a senior health specialist, to present timely and relevant information on the implementation of the GFF at country level. She will walk us through the World Bank's website and show us how to find the most relevant and recent project information on the GFF. She will also include details on the objectives of the GFF country initiative, key indicators, relevant decision makers, and timeframes that will be allocated to the relevant project activity documents for the GFF countries. Sangeeta is a senior health specialist and she has over 13 years of experience at the World Bank. She has been working very closely with FP 2020 and the reproductive health community to strategize on how to engage in the GFF. During her time at the World Bank, she was a project leader responsible for the program, technical, and administration oversight of loans, credits, and grants. And previous to that, she was a country team leader for the Deliver project at John Snow International. So we're very happy to have Sangeeta with us today. We will start off with a 30-minute presentation from Sangeeta, and she will walk us through a presentation, and she will also walk us through the World Bank website, and we encourage you to follow along in using the World Bank website. And I would ask that you please reserve your questions until the very end of this presentation. We will have 25 minutes for questions and answers at the end. And at that time, if you'd like to ask a question, please use the yellow icon to raise your hand to ask a question, or you can alternatively type a question in the comment box. But we'll come back to those details in a little bit. So without further ado, I'll pass over to Sangeeta, who will lead us in her presentation.
Okay, thank you everybody for joining. Good morning, good afternoon for those who are in different parts of the time zone. I'm going to discuss about the World Bank specifically. I do want to make it clear that I will not be talking about the GFF. I'm taking an assumption that everyone does know sort of what the basis of the GFF is and what its objectives are. But at the end of the session that we finished in 1 hour is that you should be able to understand what is the process of developing a project at the World Bank, how to find the information, and what does that information mean to you and what you can do about it. So that's sort of the 3 basic things that I hope that I can impart. So start with the broad aspects of what the World Bank is. The mission of the World Bank is really to end extreme poverty and promote shared prosperity. During the Wolfgang era, it was really about ending poverty. Since there was a new president, Jim Kim, who has joined, there's been a slight change in the mission, and that includes to address extreme poverty and also promote shared prosperity. So real focus on sort of the poorest of the poor, and also a focus on equity across. So that gives you an idea of what the bank is about. Sorry. Okay, so there are 5 agencies within what's called the World Bank Group. This includes IBRD, IDA, IFC, MEGA, and ISD, which actually is a very tiny agency that rarely most of us will ever agree with. I mean, do things with, because it's mainly to deal with conflicts and disputes. The purpose of each institution. The IBRD basically lends to middle-income countries that have creditworthiness. IDA, which is where most of our focus should be, provides practically interest-free loans called credits. So when you hear the word credit, it really means a very low interest rate loan. When you hear grant, it's absolutely free, and then you have different phases of it. most of the global fund financing that will pass through will go with some kind of IDA financing. We have IFC, which actually provides financing to private companies, and they also provide advisory services to governments and businesses. And then you have MIGA, which basically provides the political insurance to lenders who want to invest in mainly fragile countries. And as I mentioned, the other one is really investments disputes agency that provides arbitration for people who are having problems. Yeah, okay. So World Bank Organization. So IBRD, there are 188 country members. In IDA, there are 173 members. Unlike the UN, the World Bank is designed in a different format. In the UN, whether you put in $1 or $100,000, you get the same single vote. At the World Bank, it's a shareholder model, which means that the more financing you put into the bank, the more votes you would have. As you can see in the chart, US is the largest financier for IBRD and IDA, followed by Japan. And in the case of IDA, UK is the third largest financier. You have to realize that this financing is actually your taxpayer dollars. And so in essence, we are all shareholders of the bank. There are a total of 12,000 staff at the World Bank, and of those, 40% are based in the US. Okay, so the World Bank provides two major types of products and services. The first is financing, and there are various types of financing instruments that the bank uses in terms of its project financing. An investment project financing basically is an input financing model where we buy drugs, we buy buildings, we provide basically the input financing. A development policy financing is in support of a government budget. So there's an agreement of where the government is going and the policy where the government wants to go, and then the bank financing is contributed to the government budget to support its achieving its results. The latest instrument is Program for Results, which links basically the funds to a disbursement and a result. And most of the GFF financing will have Program for Results, will be tied to an instrument that's called Program for Results, or RBF, which is another one you might have heard, Results for Financing. So, and then in addition to all this, there are also trust funds, and there are numerous trust funds that the bank manages. Some of them are directly given to recipients, some of them are managed by the World Bank, and some of them are combined with IDA financing. In the case of GFF, the multi-donor trust fund, which currently has, I think, about $650 million, mainly financed by the Norwegian government, the Canadian government, and the Gates Foundation, provides a portion of this financing as a grant in coordination with some IDA financing. So for the purposes of the GFF, I think we have to realize that this is really a good deal. For $650 million, we are able to harness millions of IDA financing for RMCH. So that's a good thing for overall reproductive health and maternal child health. In addition, there's services that the bank provides, which is mainly technical assistance. Reimbursable advisory services is mainly to IBRD countries, which is basically government requesting specific advice, which they are willing to pay for. A lot of the Saudi Arabia countries, Middle Eastern countries tend to really tap into this instrument. And then the bank has what's called an economic sector work, which is specific analytical work that is done on a specific topic or a sector. I just recently completed the demographic dividend study, which was an economic sector work, which was really looking at the impact of population structure on economies. And then partnerships and donor coordination is another big aspect of what the bank provide services to. So let's look at the fiscal financing for 2015. A total of $42.5 billion was lent out to countries, the 173 countries, the 188 countries that were members of the bank, of which, as you can see, Africa was the biggest recipient of these funds, both for IDA and IBRD. And when we looked at it from a sectoral perspective, where is this money being financed? Of the $42.5 billion, 16% of it went to health and other social services. And when we look again as to what part of the region that where it went, of that $6.6 billion, which is the 16% that the health represents, 42% went to Africa. So Africa clearly is the biggest recipient for the financing of the World Bank. Just looking at the trends of IBRD and IDA, as you can see, there was a huge spike of IBRD financing in 2008-2011. This in part was to do with the financial crisis that took place, and many middle-income countries were borrowing as a result to deal with the financial crisis. And there has been a steady increase over time on IDA financing. So that just gives you an overview of the bank and how much money and where the money is being lent. So how is a project designed? What drives the project cycle? So I'll talk about the project cycle at the World Bank. It all starts with the country assistance strategy. This is a 2 to 3 year strategic document that is developed for every country that basically does a landscape analysis of everything from energy sector, agriculture sector, and determines what the financing should go for the next 2 to 3 years. I would really like you to note that the country assistance strategies are open for consultation. They are available on the World Bank website. So if you're a country participant, you should really look up yours and see if they are taking any comments, and if so, put it in, because this is where you have the biggest influence on from a strategic perspective as to where the financing should go. When I was working as a task team leader for the Mozambique project, we just completed a country assistance strategy, and actually health was not one of the issues that got much financing, and we actually didn't get much feedback also from the community on investments in financing. Sorry, people. The next one is identification. So the first step to project cycle is the identification of a project. This can be done as a joint agreement between the World Bank task team leaders, the World Bank staff, and the government. It could be a request from the government. It could be a combination of a crisis that occurred, and so forth. Once the identification is done, a budget is released to a task team leader, who then has the ability to be able to start designing the project. There is preparation, followed by appraisal, board negotiation, implementation, and completion. Now, I'm sure you all know this cycle. The question you have in your mind is, and how do I get information, and when will I get the information? So just going through the project cycle and seeing what the documentations are available at the on the website and what it will tell you. So we start with the RMCH investment case. That technically should take place before any identification mission takes place. We do know that that process has not been followed in countries as it was projected. But I think over time there will be that an RMCH investment case will be designed or will be developed before an identification mission takes place. So once an identification mission is approved and by the bank management, what comes out is called the PID, Project Information Document. This is the first time you will hear about, and we will go on the website and find it, as to what that a project is under development. What this document basically, it's a 5 to 6 page document. It tells you who the task team leader is, who the government counterparts are, and generally what the project is going to be about. It is only preliminary. It could change over time as it goes through appraisal and so forth. But just that you know that you would get this information straight after identification mission. Then comes the appraisal. At the appraisal stage, this is where they're really delving the technical content of the project. The only document that is available to the public is the environment assessments that come out, that they are required. If a project is being tagged that they need some kind of a safeguards assessment, these need to come out at the appraisal stage. Then comes the negotiation. This is when the government and the bank basically agree on the outcome of the PAD and negotiate the terms of the financing and so forth. And after that is completed is the PAD released to the public. So in essence, you actually are always going to be in a catch-up mode of trying to get information. Between the PID, which is a project information document, and the PAD, it normally used to take 18 months for the task team to go through that process. But lately, that amount has been shortened to about 6 months. So what this tells you is that the moment you see a PID, you know you have 6 months between PID and negotiation to basically influence your government, your partners, the donors in this area, or the task team leader. That's what you have. When the project gets implementation, there's two documents. There's one document that comes out every 6 months, 2 times a year. It's called the implementation, the ISR, implementation support result, and that basically tells you how the project is performing and what whether they're going to be restructuring the project or so forth. I mean, what is the outcome of the project? These are done usually at the end of a mission. So if you heard that there's a World Bank mission in town, after that there's usually an ISR that is written by the task team leader and publicly available for everybody to note. There is a section that is written specifically for management that is not available to the public, that may contain information that is sensitive to the project or issues in the country that would not be available to the public. But generally, most of it is available. It is at this stage you would be able to tell whether the project is achieving what it said it was achieving, and specifically looking at the results framework and looking at the outcomes of the results. And then the final stage is the evaluation of the project. It's one of the few agencies that actually self-evaluates all its projects. And it has an independent body called the IEG that actually also evaluates whether the evaluation did achieve what it said it was. It said the project achieved what it said it was going to achieve. As an outcome of the evaluation, there's what's called a implementation completion report, ICR, that comes out as a result, and that then informs the next round of projects that they may be designed in the area of health. As a task team leader, I do have to look at past ICRs in the health sector and write a lessons learned document and say, acknowledge that I do recognize the issues that were identified in the ICR, and I am taking into account in the new project. So all this is to tell you that you as an outsider, you are playing a catch-up game at all times, but that doesn't necessarily mean you don't have any access. And you do have access, and you do know what the timeframes are of influencing any project. I've just gone through each of these. This PowerPoint presentation will be available to you, so if you want additional information, you can go through the documents that are available, each part of the stuff. So this is again another one that just shows when the information becomes available to you in the project cycle. I'm going to pass all this because they're all what I just talked about. So let's go to the website in terms of the project itself and see how we would find this information. Before I do does anybody have any quick clarification questions that they would like to type up or submit?
I don't have any questions so far.
Okay, good. So I am gonna try and get to the website. Okay. So this, when you go to worldbank.org, and you will see on the top it has about, data, research, learning, news, projects and operations, and so forth. What you want to click on is projects and operations. Okay. This tells you, so now you have a capability of doing a search based by a country. You can do it by a sector, you can do it by a theme, or you can, and then they have a whole range of data that is available to the public that you may access also. So we're going to do it by the sector because we're interested in the GFF and we're interested in health. So I'm going to click by sector. And it tells me all the sectors that the bank finances projects in. And I'll go down and I will click on health. Okay, so this is where we get all the information of the stuff. It says overview, projects, status and results, map and charts. On the left-hand side, you have status. It says closed, active, dropped, pipeline. In this sense, basically, your closed projects, you don't have to worry about it. These are projects that have already closed. If you're doing some analytical work for, looking at this sort of how well the bank has been doing, maybe you would be interested in those projects. Active projects are those that are already, they're active right now and they're being implemented. Drop projects are those that was initiated, but for some reason they were dropped because the government didn't want them, it didn't make no sense, or management did not approve. So there could be various reasons why they got dropped. And then you have what's called the pipeline projects. Pipeline projects are the ones that are future. So this is where you really want to click. So, I mean, you could pull all the data out, and I sent you an Excel spreadsheet that actually I pulled all 3 sets of data, which had pipeline, dropped, and active. But I'm just going to focus on pipeline because we are interested in which are the GFF ones that are coming up. That gives you a list. Click on the projects button, and then you will have what's called a download, and on the right, and you will download that project. It comes up and it's available for you. Okay. It gives you the name, the country, the project ID, and the committed amount. The biggest, most important piece of information that you have here is actually the project ID number. The project ID number, if you type it anywhere in the website, you should be able to be led to the project you are interested in. So knowing the project ID is very important, and it's really the key driver of information. And so this tells you currently there are, I think, about 31 projects that are currently under design, which means what has happened now. When this data is available, which means that the PID, the project information document, is available to the public, and they are now at the stage of getting ready for appraisal and open of the full project. I'm going to pick specifically number 21, which is the Uganda Reproductive Maternal Child Health Services, because I know that project is actually is a GFF project. And I'm going to try and get, so I'm going to copy the project ID. And I can put it in the keyword here. And this is where the project comes up. Okay, we're going to open up this document. We know, now this might be very slow for those who are based off-site. And I don't know whether the bank has any other format that you can do it in. But one of the things you must have received is Uganda PID, which is exactly the same document. So let me just pull that up for our purposes. What the project implementation document tells you, first of all, it tells you the project name. It tells you where the investments are going, which is 100% in health. It tells you the themes it's going to be supporting. So you know, population and reproductive health, 60% of the financing is going to be supporting that. And these are the critical things you need to do. The other critical things you need to know when you're looking at this document is the estimated date of board approval. So looks like that they are planning to take this project to board by June 15th, 2016. So now you know you have less than 3 months between now and board approval to influence any aspect of the bank, this project. It will generally have what's called introduction and context, which will be the country context, and it'll tell you information about that. Sectoral institutional assessment, it will just sort of, this is background stuff. I would not waste too much time on this. It may have some information as to sort of the relevance of how this project fits within the CAS, which is the country assistance strategies, and the overall situation in the country. The things you need to focus on in this document is the proposed development objective. This tells you where what they're going to be, the project is going to be focusing on. In this case, it's going to be to improve delivery and utilization of quality services and maternal child health services. Doesn't really tell you much, but at least you know, you're getting a general idea where the investments are going. Why is this critical? In order for, once a project has been approved, if a task team leader wants to change the PDO, it requires the task team leader to prepare a paper that has to be approved by the board. So what happens is that a significant amount of time is spent in trying to determine the PDO, and significant time is spent in TTLs trying to not have to go to the board for anything to change that. So what does that mean for you? You should try and make sure that this PDO really captures the critical things that you care about, because once it's in there, the likelihood of it being removed is very unlikely. And then the next things that you really should focus on is the key results. And the key results here are focused on that this project is going to be achieving is increasing antenatal care, contraceptive, assuming increasing contraceptive prevalence rates, increase in deliveries, immunization. So if there are any of these issues, you want to see it here. As a family planning advocates, you see that CPR is included. But you might be saying, wait a minute, you know what, that's not enough. What we really want to see is increase in CPR among adolescents or among 15 to 19-year-olds or whatever. And so this is where you really need to start thinking about what is it that you as an advocate would like to see, and then we would come up with strategies of how you should be trying to get this in. The preliminary description basically tells what they will be financing, what types of things, and it gives you a sort of an estimated cost of how much each of this is going. The first component is going to be about $70 million, and it's going to be focusing mainly on seems to me improving the delivery of RMCH services and establishing the CRV. The next component is really focusing on delivery, obstetric care, and that's another $70 million. And then the third component is on the civil registration and vital statistics, which is going to be about $10 million. Now, if you note this, family planning suddenly, when it comes to the component description, seems to be kind of lost. And so again, you need to keep note of that and work out what you want to focus on. It also tells you what safeguards are being triggered as a result of that. What this means that you should expect ones that have triggered safeguards that they during appraisal, these assessments should be coming out and available to the public. In the case of health sector, an environmental assessment is most likely to be triggered, partly because of medical waste management. One would expect that. In malaria projects, we expect pest management to be a big aspect of it. And then overall, it tells you how much the total project for. In this case, the IDA financing is going to be about 110 million, and the health results-based financing, which is the GFF portion of it, is going to be about $40 million. So this tells you that the grant amount is going to be about 40 million, and 110 million is going to be the credit amount. Again, credit's extremely cheap for through IDA financing, so it's not really that important to focus on whether it's a loan or not a loan. The other key point that is really important to note is now you have the contact information. You know the contact information for the World Bank. It's Peter Oquero. He's the task team leader. You have his address. You have his telephone number. That's available to you. The other thing that is critical to know is that you have the borrower's information. You know the Minister of Finance. You know exactly who the contact person is. And in the Minister of Health, you also have the contact information, who it is, and their email address. So you have a wealth of information between the PID and the PAD of people you could target, people you could influence, and people you should be talking to in trying to ensure that the project design includes the key issues that you care about. I think that sort of briefly gives you the format of what's available in the stuff. I am going to talk quickly, give you the thing on the ISR. The PAD, again, is the full PAD is 140 pages long. I'm just showing you the Tanzania one. That has more in depth. There's certain annexes you should really focus on. For example, procurement. You should always look at the procurement annex, which is really critical in understanding how the financing is going to flow. And then this is an example of the ISR, the Implementation Support Report. This is for Tanzania, which has a GFF component, which basically tells you right now that currently they feel that the project is satisfactory and there is a substantial risk. It tells you a little bit more about what's going on in the project. And one of the key issues that's coming up is that the work plans have not been developed yet, and so they need some help in the work plan development. And it tells you disbursement, how much has been dispersed. In this case, nothing has been dispersed. All financing is just sitting there. And it tells you what the closing date is, June 30th, and the approval date. And usually at this point, it also tells you, though this one is not telling you, but one should expect that once a project has been approved, you would expect within 2 years to be a midterm review, and the midterm review is a place where they may restructure the project. So it's another opportunity and another date to remember if you want to influence this, the change in this project. As you can see, currently they have not able to report on any of the indicators, and it's only been the first ISR. One would not expect much. However, if you find this on the third one, you should be writing to the government and say, wait a minute, or you should be writing to the donor and saying, wait a minute, how come this project is not reporting on any of the indicators it said it was promising? At the end of the day, it is your tax dollar funds that are being used, and therefore you should be holding the bank accountable. They've made information available to you, and therefore you should use it to make them accountable and the government accountable. I think that sort of pretty much captures as to the information that is available on the bank website and what you can do and when you can do it. And so that concludes my presentation, and I'm open for questions. I pass it on to Erica again.
Hi, Sangeeta, this is Emily. We got a couple of questions here, and there's one question that comes up quite some. There's some people asking, how can you know if you have all these projects in the pipeline? How can we know which are funded by GFF or which are GFF specific?
So you don't. The only way to do it is to look at all the health projects, and supposedly there are this list of countries, right? There are 51 countries or 62 countries, I'm not sure, and supposedly there are front-runner countries out there. The only way I have been able to do it is I knew the countries that were publicly being discussed, and so I definitely checked those, but I actually opened all 31 PIDs and reviewed the 6-pager to see if it mentioned any GFF financing. So it's not an easy process, but it is something you just have to do in going through it. The way I keep control of this whole thing, I will once a week just go and add on new projects. So once you've established 31 projects, once you've established that, not more than 1 or 2 projects enter the system in a month or so. So it makes it a lot easier. The first 31 is a little painful to do. I have written on each of those, so once this seminar is over, I will share a summary of the 31 projects and sort of what they are covering and what they're not. I also shared an Excel spreadsheet that showed whether they had a reproductive health component to it, and so maybe that's the ones you focus on.
Okay, great, thanks. Then we got another question from Susanna Dennis, who's asking how the civil society members of the country platforms will be consulted in deciding which project gets prioritized.
So not the project. So country, what will happen, the RMCH platform is where the investment case is supposed to be developed, is where the civil society would be consulted, or supposedly there is that platform that should be established to allow civil society to be engaged in. But when it comes to project specific as to what project will be designed, usually civil society is not consulted. It's very much driven by government, country, global issues, and emergency.
And then Halima, who's asking if there's only 11% of the World Bank support going to the social sector, then isn't there just a little hope for RMCH issues to get real funding?
Well, yes and no, but I mean, if you think about 11% of the World Bank portfolio, 42.5 billion, it's really not that insignificant. Yes, it's not that great, but it's not insignificant. And it's not only for RMCH, it's for the overall health. Certain projects will have no components on RMCH. A lot of the projects in ECA, a lot of the projects in Brazil tend not to have as many RMCH or public health issues in their projects. So yes, the portfolio is small. But you know, the bank originally was designed to be an investment bank, a capital infrastructure bank. It was only under Wolfusang that it changed its and included human capital, and it has continued to invest in that. So for me, I think it's still a great way forward.
Okay, another one from Susanna. Is there a way to know how much of the IDA money leveraged is additional to what was already going to be spent on the country? And can we be clear on what financing are loans and what are grants?
Okay, so the question you're asking is had there not been GFF, would Tanzania still have invested $100 million? Yes, possible. But I think what has happened with the RMCH platform is that it's ensured that it's really focused on public health and on women's health. So I can't say whether the financing would, had this platform not been available, would the financing still go into health? I'm not sure. I think we would have to look at country assistance strategies to see what was designed in the original countries. The second part of the question was, sorry, could you please repeat for me the second part of the question?
Yeah, sure. Can we be clear on what financing are loans and what are grants?
Okay, so mostly in the PID or the appraisal document, it will tell you in the first 3 pages of whether it's, let me see if I can pull out the Tanzania one, whether it's going to be a grant or a loan. If it says GFF trust fund, trust funds are usually grants. If you see the word credit, that usually means a very low interest rate loan paid over 35 to 50 years at a very concessional rate. And if you see the word loan, it definitely is a loan. So, and that is mainly for middle income countries. I'm just pulling up the Tanzania one to see if I can. So this one is the Tanzania one is a total of $2.620 million dollars of the whole total amount. Includes credit. As you can see, there's a credit is ticked, and so has the grant and the other. The other is usually the government financing, that they have also put some financing towards that. Their financing could be in human resources, paying, salaries, infrastructure, so on and so on. So it tells you, includes global financing facility, achieving nutrition. So this one has also a nutrition impact scale, multi-donor trust fund. USA has put some money into it, and so there's a total, it gives you an idea. So normally page 3 of a PAD has the details of what's what. Borrower recipient is putting about 2.03 million. IBRD and IDA is 200 million, so that's most likely a credit. Global financing facility is putting another 40 million. That's probably a trust fund, so it's a grant. The next one is a grant. The next one is a grant, and the other partners, it is most likely grant, for instance, Danida, Canadian, and so on, who are putting parts to the budget support.
Okay, and then we have a last question from Erica. Can you explain the role of the safeguards assessments? Is there an opportunity in the development of safeguards to discuss concerns of quality of reproductive health commodities procured at this stage?
Okay. I know this would be the great place to actually get some kind of a reassurance for reproductive health, but as you've heard, last year the safeguards policies was highly diluted. It became a global issue. In all the safeguards were highly diluted, and instead of the bank checking on the safeguards, there was a proposal that actually country systems would be followed for safeguards. So I think going down the safeguard route is the least likely to get positive result, in part because the testing leaders hate safeguards, the government absolutely hates safeguards, and there would be extreme resistance. Even bank management really doesn't want to go down that path. There would be extreme resistance to add any additional safeguards to the current ones that they are. In fact, there is a whole energy being spent on trying to dilute safeguards. So I don't think there is an opportunity to really focus on creating safeguards for commodities. When the HIV crisis was taking place, I was at the bank in 2000, and we explored the opportunity to do a safeguard for HIV, commodities, and it was totally shot down. So I think that would be the wrong path. I think you're going to get resistance from your countries. You're going to get resistance from the World Bank. The only people who are on your side may be civil society, but everybody else will be really not in support of you, including your political leadership for safeguards.
Okay, and one more. Will there be any reporting on the GFF spending by sector, like, for example, family planning? And if not, how will we do that?
Nope. There will be no available funding. No, the bank does not report that way. You will never get that information, and you can't. All the bank does is, this is the 2.6 billion, this is what we agreed on, these are the results. The way civil society can hold the bank accountable, the GFF accountable, or the country accountable, is focus on the results. What are the results you promised for 2.620 million, okay? And 2.6 billion. And follow the result. Don't follow the money, because you're not going to get information about the money. Once it's put in one big pot, it's very difficult for us to separate it out.
Well, thank you very much, Sangeeta. This is the end of the questions, so I'm referring back to Erica.
Thank you.
Thank you very much to everyone who joined us and who asked questions, and thank you very much to Sangeeta for taking the time to walk us through this important information. This webinar will be available publicly shortly, so you can share it with colleagues that that weren't able to join us. So I'm going to close there and thank everyone.